So both semaglutide and tirzepatide are going to facilitate weight loss. Most people tend to report worse side effects with semaglutide because tirzepatide also has a GIP agonist. People tend to tolerate it a little better, experience a little less nausea and vomiting. And in the original trials, tirzepatide was able to show slightly better weight overall. So when patients come, they're starting fresh, we usually push them towards tirzepatide because we feel like they're going to tolerate it a little better. They're going to have slightly better overall weight loss. That being said, we have a lot of patients on semaglutide. They like it and they prefer to stay with that, and that's fine too. The first thing you should do is let your doctor know. And if I'm your doctor, I would want to know if you are having extreme side effects. We can adjust the dose. We can go to a smaller dose. We can sometimes go at a smaller dose and dose more frequently. We can add other medications to help, for example, Zofran for nausea. And sometimes it means you just have to take a little break from the medicine for a short time and come back with an adjusted dose. But definitely you should let your doctor know if you're having extreme side effects that are keeping you from living your daily life or going to your job. So the question of whether you need to stay on this medicine forever is a little bit loaded. If you've reached your goal weight, then there's definitely a possibility for you to wean off this medicine permanently. What I would not do for most patients is completely stop. Usually we will have a patient's medicine and then sometimes half it again, and that can give them a little bit of that restriction on their diet while they can get back to and hopefully maintain good eating habits, not regain all their weight. There certainly are some patients who just have propensity for overeating, and some of those patients do need to stay on this medicine forever. On the other hand, we have patients who are only dosing once every 2 weeks or even once a month. That allows them to keep in check. If you stop the medicine and you regain some weight, it's perfectly safe to just go back on and lose those pounds again and try again later on with more kind of diet in place and a little bit and a better plan to keep you in check.